Alright, so if you look into your book on 230, you'll see that Dr. Greenman there is doing his best to correct the FRS dysfunction. So what I like to do is have somebody come up. Warren, maybe? Where's mine? And for this, so what we want to do is we certainly want to get to the interspinous space of the segments that we're dealing with. And again, we're working at 2 and 3. And where we're going to be, so we're going to first find our landmarks. C7, that's C7, so T1, T2, interspinous space of T2-T3, right? FRS the left 2-3. Now I've got my monitoring hand here, finger here, and what I want to do now is I'm going to place it over the area of where I'm hoping and expecting to eventually feel the transverse process come into my finger. Okay. When I corrected for the ERS, I was on the same side as the transverse process that I wanted to push away. Right. For the FRS, I'm going to be on the side that I'm wanting to feel the facet starting to close. So it's opposite the position of the FRS because that's the dysfunctional facet joint. Correct? Correct. So if it's an FRS to the left, which facet joint is not closing? And that's why I want to palpate there. I want to feel for the motion to occur to know that I'm actually achieving the motion. Okay. From there, I'll bet you could all pretty much talk me through it without too much problem or hesitation. It's a flexion lesion, so what do we have to do first? Extend. I have to get a moment of extension going. So, could I, and I'll be really careful with you. I told her I was busy later tonight. So. All right. So, here we go. Could I do it all with the neck? Is it going to feel that great? Not really. Okay, so what can I do instead? I can chin tuck. What can I also do with the trunk? I can do what?
Extend.
I can do a little bit of a P to A motion right through my finger. Now, the moment of extension that I need to achieve is far less and less stress through the neck. Okay? And I can also control the side bending with my trunk and my hand that's palpating the interspace. So I can get a little bit of side bending, correct? So instead of doing it all with the neck, I can do a little bit with the neck and a little bit from below. So a little from above and a little below.
How are you doing it? You're pulling?
Yeah. Yeah. I'm guiding her over towards me. And she's being very good at letting me place her where I need to start the position. The other nice thing too is I have what's called a swan neck grip over her head, resting with my forearm along the zygomatic arch, which means I can control the side bending, the flexion or extension, and the rotation, all from that position. And the closer you are to your patient, the more control you're going to have with your patient. So, P to A to get some extension. Bring her back with the neck just a little bit with a tiny bit of retraction. Translate her towards me, causing side bending away, which is where I want to go. And now I just want to get, there it is. Get that rotation right at the level. It almost seems like I'm not even close to being there, correct? But as I took up motion in all the other planes, it allowed me to localize to the treatment plane. So now all that's left to do is ask her to help me do the muscle energy. Warren, what I'd like for you to do is I'd like for you to try to bend your head forward and side bend your head to the left against my resistance. Go ahead. Hold. 2, 3, 4, 5. Relax. 2, 3. Further extension, side bending, and rotation. I can now feel the facet joint starting to close because I feel the prominence of the transverse process on the right coming into my finger. Again, one more time. Down and to the left. Hold. 2, 3, 4, 5. Relax. 2, 3. Further further extension, further side bending and with translation, and rotation. Notice how I'm also keeping over her base of support. And I'm just going to be a little outlandish here and do this. I'm not pulling her like this, am I? She's balanced. She's localized. And that's how you're going to get the best outcome with your patients, is keeping them over the base of support. If you do these large motions, pulling to the side or rotating or flexion, you're taking them out of that, so you're making them a little less stable, harder to localize. All right? So keep that in mind when you do it. And now what do I do to check to see if what happened was what I was hoping would happen? Just come in and do my assessment. It was an FRS to the left, which means I need to definitely check her in neutral and definitely check her in extension. So in neutral, she's level, come up into a little extension with some chin tucking, good, and she's symmetric. So we confirm the correction of the FRS to the left. All right? Okay. To set a little bit more to help gap it, is do your rotation first. Lauren, please rotate to the left. Hold. Relax. And you're palpating for the transverse process to come in towards your finger a little more easily. Okay? One more time. Relax. Good. Now take her into a little extension and a little bit of side bending. And translate her towards me and still localize to the segment. Now look down into the left. Hold. And relax. And you have your correction. Same end result, but absolutely for sure, 100%, that it could make it more comfortable for the patient initiating with rotation first. So let's break into our practice groups. I want the patient positioned just the way that I have Lauren here, therapist on the same side that I am. We'll go up to the point of rotation, do the gap, and then we'll correct fully for the FRS to the left, okay?